it is a possibility that we can start to guide treatments based on what we see in neuroproliferative vestibulodynia, because we do see common overlap between mechanisms in both. However, we still will need to further our development to understanding the mechanisms upstream that drive this nerve growth in endometriosis in order to develop these targeted drug treatments. Um, and so this is really a future project is also understanding how endometriosis is molecularly classified and how we can develop targeted treatments. This goes back to how we can't say for certain that someone has neuroproliferative dyspareunia based on how they present, just because we don't have that diagnostic criteria yet. It's also entirely possible, again, that someone might have neuroproliferation with inflammatory or central sensitization mechanisms that are driving their pain. Given our cohort size of around 170, it may also be too early to definitively say that there's no correlation between nerve growth and other pain types. So this will go back to us needing to understand the mechanisms of nerve growth in endo for us to really allow clinicians to better phenotype these patients. Future investigation will need to look into serum biomarkers, specifically how we've correlated nerve growth factor to peripheral nerve bundle density. It would be interesting to see whether serum levels of nerve growth factor correlate to our findings. But overall, I don't think that it's certainly a disadvantage to identify neuroproliferative dyspareunia after surgery as we start to develop these drug targets for neuroproliferation. It would be useful in knowing to target recurring pain. But the message we'd like to drive home is that there is a potential biological cause for deep dyspareunia in endometriosis, and we're hoping that clinicians can use these findings to counsel their patients that some may have more nerve growth around their endometriosis lesions than others due to differences in cellular signaling, genetics, etc., that may be contributing to their experience. And so that's really where we're at right now is we see evidence of nerve growth in patients with deep dyspareunia, but we need further research into understanding its mechanisms and developing targeted treatments.